Okay, we'd like to welcome you back to part 7 of our current event and weekly Bible study for June 14th, 2015. I'm still plugging and chugging here, and praise the Lord Jesus Christ. So I'm going to try to go ahead and wrap this thing up here and get this out. Now, the next report is synthetic vitamin supplements exposed. Now, when I read all the things about in the last study, we talked about 8 ways they're trying to feminize men, and it's just not messing up men, it's messing up women as well. I felt like they left out at least one other thing as far as the lowering of the testosterone and the sperm count in men. So that's what we want to talk about now. This is, but this is a synthetic vitamin supplements exposed. This is kind of exposing that whole thing because it's part of that problem. This is by far the most popular way to supplement the diet with nutrients. Meaning, go get your Flintstones or your Centrum Silver or your Geritol, and go put those toxic synthetic nutrients into the body, which are made the same way drugs are made. And it's just the same as the way God made things in nature, right? It's all good. And I'm sure that the big pharma companies that own those companies would never do anything in any kind of nefarious way to hurt us in any way, shape, or form. They would want you to feel comforted that you're taking your Geritol and Centrum Silver and these types of things. And it's just the same as any kind of whole food supplement you're going to get in the health food. And again, you can find these more and more in the health food stores. People are finally wising up to this concept. Standard Process did it since 1929, okay? But now finally a lot of companies are coming out and making whole food lines. Okay, I can't vouch for the quality of all of them, but it is happening and it is a positive trend I am seeing. So during the manufacturing process, the organic nutrient that is considered to be essential, the essential component of a vitamin complex, and this is then synthesized in a laboratory from non-food compounds from such substances like coal tar. This is how they make synthetic vitamins. Okay, this is very similar to the way in most drugs are made. Okay. Thiamine mononitrate, for example, or B1, is derived from coal tar and is labeled. I mean, they come in big 50-gallon drums made by Hoffman LaRoche chemical companies, and they combine all of these synthetic nutrients together into a vitamin pill and say it's just as good as eating an orange in nature and eating these same whole foods in nature, and it's not. It is a synthetic abomination. Is what it is, okay? Thiamine mononitrate, for example, is the B1 molecule derived from coal tar, is labeled as vitamin B1, is in nearly all popular, quote, B complex supplements. This factor has been directly linked to a 78% reduction in sperm count among American males from 1938 to 1990. Wow. See, this is the first thing they started doing, or one of them. We talked about all the stuff that, granted, beer's been around for, since then, but we didn't always have the bottled water. We didn't always have the prevalence of soy in the diet like it is now. That wasn't prevalent back then. We didn't have a lot of the things that they've ramped up now we didn't have back in 1938, or near to the extent that they are now. So this is one of the main ways they got the satanic ball rolling, was through vitamin B1, synthetic. How do you know? Well, if you read the label and it says thiamine mononitrate, most likely it's synthetic. And not only that, if it's like some nice neat number like 2,000 milligrams or something, you know it's synthetic, because in nature it never occurs that way. It'll occur at much lower levels, and it'll usually be some like off the whatever, like not nice neat number. Now sometimes whole food supplements can make they're like 100 milligrams or whatever, okay? But it's normally never into these astronomical ranges because it doesn't occur in a whole food state that way, okay? The tablet would have to be as big as a beach ball in order to get that much in there from a whole food source. So it's different, but you don't need to take as much of it in a whole food source because it has all the cofactors that naturally occur in nature, which is the way God intended it to be. It's the difference. So their analysis of data collected from 1938 to 1990 indicates that sperm densities in the United States have exhibited an average annual decrease of 1.5 million sperm per milliliter of collected sample, or about 1.5% per year. Source, National Institutes of Health. Now, you could say, yeah, but I knew like my grandpa, and he never took like any of those vitamins back then. Yeah, you know what? They were fortifying a whole bunch of stuff like the bread. Wonder Bread rots bodies in 13 different ways. Well, they were rotting your body with all of these synthetic chemicals. They were spraying back into the white wallpaper paste they were calling bread. Wonder bread. Does a body wonders. And so that's how they were doing it. They were spraying it back into the foods. You were eating, quote, fortified foods, getting all of these wonderful vitamins, and this is just one of the fun side effects, a 78% reduction in sperm count. You think there hasn't been an agenda for a long, long time to institute depopulation? Yeah. Then you have white bleach flour, has more than 30 known nutrients removed, and then 4 synthetic vitamins sprayed back in. This enrichment of the flour began in 1939, when by law the FDA required the addition of a few new synthetic factors. These are thiamine B1, which is what we just talked about, the one that lowered sperm count 78% from 1938 to 1990, and then you have riboflavin, or B2, and nicotinic acid, B3, and iron. Coincidence? I doubt it. Excess thiamine mononitrate consumption also mimics most of the signs and symptoms of a hyperthyroid disorder. The synthetic version of thiamine differs from the food source of vitamin B1, such as a true whole wheat. The synthetic version differs from the food source version of vitamin B1 in the following ways. Number 1, synthetic thiamine mononitrate B1 contains none of the cofactors necessary for vitamin B1 to be utilized in the body. In other words, the way it would occur in nature, the way God intended it. It doesn't have those cofactors. It's isolated and it's synthetic. It's like a drug. It's exactly the same concept as a drug. Vitamins analyzed in food are always found in combination with numerous enzymes, coenzymes, trace minerals, and other activators that are necessary for the vitamin to be utilized. This is how God intended man to get vitamins and minerals. Satan comes along and says, oh, no, we want to give them synthetic garbage, frankenfood, that will devastate them over time. But we'll bill it as the greatest thing since sliced bread, no pun intended. Number 2, the amount of thiamine mononitrate B1 found in synthetic B-complex supplements is far more B1 than could ever be consumed in a food-based diet, meaning it would never occur in those concentrations in nature, ever. It couldn't. Example, the typical orange has about 5 milligrams of ascorbic acid, which is commonly referred to as vitamin C. Now, you got to understand, vitamin C, ascorbic acid, if you look at the whole food vitamin C complex, the ascorbic acid is on the outer rim of that complex. It is the preservative aspect of all the good stuff that's inside the vitamin C complex, like organic copper and these things called J factors and K factors and P factors and things of this nature. Highly complex food-based compounds within the vitamin C complex, which is the way that God intended it to be. That's why, like, the C I use is a whole food C. Okay? That's what I advocate. I never advocate people taking ascorbic acid, which can is particularly at high doses, produce all kind of side effects. But you know how much that's been pushed for so many years? Synthetic vitamin C? And they'll say, take it to intestinal tolerance if you really are serious. That's when the body's so trying to get rid of that garbage that it gives you diarrhea because your body can't take in anymore, and it's trying anything it can to get rid of it because it's identifying it as a toxic substance. That's intestinal tolerance of ascorbic acid. Okay, so the typical orange only has 5 milligrams of ascorbic acid, whereas some authorities today advocate taking as much as 20,000 milligrams of the synthetic ascorbic acid. And guess what? That ascorbic acid is all GMO, unless it's otherwise stated. They're getting it from GMO corn, Frankencorn, the ascorbic acid, as if the ascorbic acid is not bad enough, it's GMO. And you're going to find very few ascorbic acids that aren't GMO. They got you coming and going. Most people, they don't even have a clue. I'm not saying that because I think I'm better. I'm just telling you a fact. You're still killing yourself. You're still eating yourself into destruction. But you think you're doing the right thing. How could this discrepancy be reconciled? Nowhere in the history of mankind has anyone ever consumed these kinds of concentrated, isolated, synthetic nutrients, not to mention in these sheer quantities that are being advocated. In other words, more is not necessarily better. Well, this aspirin works really good. Let me take the whole bottle and really let me see how it works. Okay, well, prepare to meet your maker. You know? I mean, seriously. It's insanity. Other examples of the commonly synthesized vitamins used in supplements include D-alpha tocopherol, labeled as vitamin E, and beta-carotene, labeled as vitamin A. Like thiamine monotrate, these synthesized vitamins contain none of the cofactors that are found in the food source of the vitamin and are used in far greater quantities than can ever be consumed in the diet. And guess what? Any studies that they have ever done to demonize vitamins always use the synthetic versions, and guess what they find out? Ascorbic acid does DNA damage, and it's like if you even eat 500 milligrams of that stuff every day. They found it actually damages your DNA, and it probably does. And so they can just demonize vitamin C altogether. Throw the baby out with the bathwater. It's all bad. No, it's not. You have to have vitamin C. You can't, well, I did see a study the other day saying that there are certain cells in the body that they found can produce vitamin C. Well, I don't know. I'm not 100% sure about that. I'd have to see more of the research, but we can't produce it in very large quantities. That's for sure. Okay, animals can. They have a mechanism to actually make vitamin C. I know I don't have a big mechanism to make it because it's the main thing I take to keep me feeling my immune system high. They said, well, I thought it was the silver. No, the silver acts as a secondary immune system. I typically reserve the silver to keep candida levels down, or if you're in some type of thing where you're really trying to fight something off and you really need to ramp up the immune system, you need some extra help, or if we got into some type of pandemic scenario where it's like life or death. Yes, it's the number one product I would turn to. But for everyday health, I don't think there's hardly anything better than a good whole food vitamin C. A D3 is important too. I don't seem to need as much D3 for some reason. See, remember, everybody's different. This isn't all cookie cutter. Taylor needs a lot of D3. I don't feel like I hardly need the stuff. I feel like a little bit is good for me. Taylor doesn't hardly need the whole food C though, like I do. I need to take that stuff. I usually take a couple tabs a day. If I drink coffee, it absolutely decimates my vitamin C loads, and I have to. Granted, I don't ever have more than a cup a day, if that, and it's organic, and it's like, really, really good, and it's not a lot, and I don't drink it by the pot ever, and I don't even have it every day. Probably have on average a cup maybe every 3 days, maybe. But if I were to try to drink it every day, it absolutely, I need to take more and more and more of the whole food C. Coffee doesn't agree with me. It really messes up my immune system. Even organic. It's just me. You got to understand though, everybody has their weak links in their chain. That's something you have to understand. We're not all cookie cutter. One thing that works for me might not work for you that great. So bear that in mind if you get a product and you're having all kind of expectations and it doesn't work. Well, maybe it wasn't something that you really did need. I mean, trial and error. You know how many products I've experimented with over the years to try to find the stuff that works and the stuff that doesn't work so that I can come back to my listeners or the patients and say, hey, listen, I tried this. I really think it makes a big difference. You might want to try it. That type of thing. It's, trust me, I learn new stuff typically every day. Still learning. So let's go further here. Okay, so this is another point. Just as a chemist cannot create life, a chemist cannot create life in a laboratory, in a test tube beaker. Okay, in other words, neither can he create a complex vitamin. The life element is in foods and nutrition. This is a mystery the chemist has never solved and probably never will. And the synthetic vitamins he creates on the basis of chemical formula bear as much resemblance to the real thing as a robot does to a living man, lacking an elusive quality that chemistry cannot supply. I get chills reading that quote. You know who said that? Dr. Royal Lee, dentist, although he never practiced dentistry, 1953. You know who he is? He's the guy that developed standard process. He's the first guy on the planet that ever came out with a whole food multivitamin, multi-mineral supplement. He's the first guy that ever got it, as far as that goes. And actually, I'm not saying he's the first guy that ever got it. He's the first guy that ever did anything about it on a mass scale. He developed Catalin in 1929, which is their multivitamin they still have to this day. It's not typically the one I use now. I like the Innate Whole Food line because it's a one a day and it's more custom tailored to the person. But it's still a great product. And for some people, that's what they, I'd still prescribe that. I have it in stock. 1929. That's how ahead of his time was. Do you know how demonized this guy was? The kind of stuff he had to fight back then when he had no allies, hardly at all? And how he was demonized and marginalized by the medical society for doing what he was doing, but he was getting results. I'm looking at hundreds of products I carry from that product line. And he's the guy that started it. He's the guy that got me into clinical nutrition, clinical nutritional supplements based on whole food products. It's what makes sense. From a biblical standpoint, it's what makes sense. Did you know most vitamins on the market claiming to be natural only have to be 10% natural to make that claim? Yeah, that's it. 10%. Here's a salient point. The problem, just so you know what I'm reading from, is the actual presentation. It's my presentation, Destroyed for Lack of Knowledge, what your doctor's not telling you. I've never done this in full online, ever. This is just a small portion of it. It's like, I don't know, it's up to 70 pages long now or something. It would take me like weeks to get through it. But I did this first at an independent, fundamental, unregistered Baptist church conference in Indianapolis, Indiana, like, I don't know how many years ago. 10, at least, maybe more. I did this there. This is the first time, but it was a lot shortened, and I only got through a little bit of it because I thought I was going to have more time. But that's where the idea for this came, and this is just some stuff from the presentation. Anyway, just a little trivia there. Salient point: the problem is that when the body is lacking nutrition, it's not lacking in one isolated nutrient. Whatever the patient did to create the vitamin C deficiency, they at the same time created a deficiency of all the other cofactors that go along with the vitamin C molecule in nature. It's a very complex molecule. We don't develop synthetic vitamin deficiencies. We don't develop those. We develop, in fact, if you take a whole bunch of synthetic vitamins, guess what? The body's not expecting that. So when it gets these isolated synthetic vitamins in mega quantities, the body says, whoa, 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 what is going on here? And it will try to throw all of these other cofactors at those synthetic vitamins that normally would occur with them in nature, and you end up becoming deficient in the cofactors. So it actually creates all kind of other problems in the body. It creates all kind of other deficiencies in the body. And at first you might even feel better. You might say, hey, this synthetic vitamin makes me feel all perked up. Well, it's like taking a drug. You're going to feel better initially, just like you do on a drug. But eventually, you're going to start having side effects and you're going to start having deficiencies of other things. For a long time, though, when you took your Geritol and your Centrum Silver and all that stuff, there was no harm done. You know why? You would just, how do I say this nicely? Number two, you would just poop it back out. Do you realize in the porta potty industry, and I don't know how prevalent this is now, that they literally had a gigantic problem where these people that were on all of these synthetic vitamins like Centrum Silver and Geritol or whatever, they were swallowing these things, they would literally come out in the same way that they went in. You could literally, they had screens that would catch the vitamin pills. And in a lot of these porta potty places, you would go out back and there would be a mountain of vitamin pills in the back. I've heard this more than once in the porta potty industry. And you could literally, and I wouldn't advise doing it, but if you looked at these vitamin pills, you could literally still read Geritol, Centrum Silver on the label. They were so inorganic, undigestible, And again, you look at like something like calcium carbonate, which is one of the main ingredients in cheap vitamins. Calcium carbonate, basically ground up rocks. Takes like 12 to 13 steps to convert to usable calcium in the body. And by that stage, you're only absorbing maybe 5%. Causes calcification of like the kidneys, arteriosclerosis, causes all kind of problems in the body. Calcification problems. And that's what's commonly sold. Oyster shell. Yes, let's grind up some oyster shells and put it in a vitamin product, and your body will absorb that great. Or iron oxide is iron. Oh, that's just rust. That's literally the chemical composition for rust. Well, let's take some rust and put it into a vitamin pill and call it iron. They know what they're doing. All of this, again, is by design. The best case scenario is it passing right through you and you're not digesting it. At least, hopefully, other than maybe the glaze on the thing, you're not absorbing any of this garbage. So minimal damage is done. But yeah, in the porta potty industry for years, they had this gigantic problem. I don't know how prevalent it is now. I think what they're doing now is they've got these liquid gels and you are absorbing it. Oh, they're giving you the good stuff now. What they're giving you now is really, really working good. You were way better off before if you were taking those things and not absorbing them. If you're taking one of those liquid gels now from like Geritol or Centrum, it's I can't even imagine what's going on with that. You know, death on a stick. Here, honey, take your death tablet. Thank you, dear. I really do believe you care about me. You know, I mean, sorry, anyway, a little humor there. So let's go forward here. Okay, so continuing with that salient quote, we don't develop a synthetic vitamin deficiency, we develop food deficiencies. Some foods have up to 3,800 nutrient compounds. That's how complex and diverse God made just food. To nourish the body and to make up for nutrient deficiencies, you have to give the body real food. Now, yes, the body has a lot of compensatory mechanisms, but that doesn't mean it's ideal, you know. So, my recommended whole food multivitamin mineral formulations. Okay. Now, I'm biased. Obviously, these are the lines I carry, but I'm not saying there's no other ones you could buy. I'm saying if somebody were to ask me, I use, like, with the innate line that I told you about, I use the innate response. They have a woman's one a day. They have a woman's one a day for women over 40. They have a men's one a day. And they have a men's one a day for men over 40. It's a one a day, 60 things, a 2-month supply. And I think that that's a foundational thing that if somebody said, well, I only want to do one thing, well, that's what you do. Okay, I want to do 2 things. Well, if you have any immune system issues, I do the C400 or the powdered C from innate. Because I know that if I didn't do that C400, the poorly functioning immune system is what got me into chiropractic, got me into alternative health, and if I didn't do that stuff, I'd be hurting for certain. You know, that's my weak link in my chain. Not everybody needs that every day. I mean, you do need C though, but it seems that some people have the ability to not need as much, especially if you're drinking a lot of coffee, which I don't do, or God forbid you're smoking. You're just burning up your C. You're just burning up your antioxidants. That's why people that smoke age so quick. They're burning up all their antioxidants. They're producing massive amounts of free radicals. Free radicals age you. They tear your body down. Your lungs love it too. They just love that smoke. They can't get enough of it, you know. Well, when they put hundreds of compounds in the cigarette that are addictive, and then when you light them, it creates thousands of compounds that are addictive. They know what they're doing. They got you hooked. I've heard it's harder to quit smoking than it is to, it's easier to get off heroin than it is for a lot of people to get off cigarettes. I don't know. I never did either. Doesn't that make me like whatever, some perfect choir boy? I'm just saying I just don't have any desire. So I got those 4 products listed. And then innate response also makes a 1 daily, which is just like, okay, I just want one thing for my whole family. Okay, here's a 1 daily. It's not as specific as the others, but it's your multi. Okay, some people like that. Catalin, the one I mentioned, Dr. Royal Lee, probably my most economical as far as, you know, economical, cost-effective one I've got. I mean, a big bottle's like 360, but you know, if you're really doing a lot on a daily basis, you really need about 6 a day. You know, they're tiny tablets. They're not real big. Anyway, Catalin's an option. People ask me, what about prenatals? Well, again, the prenatals they give in the hospitals are a beyond garbage, beyond a joke. They typically use iron oxide in their prenatals because you need more iron when you're pregnant, and it's something that's super super important. Yeah, so the one that I like is the whole food prenatal by Innate Response Formulas. It's Baby and Me trimester 1 and 2. So see, they understand that you have specific needs for the baby and the mother in the first 2 trimesters, and that shifts some in the 3rd trimester and the post. And there's a Baby and Me trimester 3 and post. Each comes in a 120 tablet bottle. I would recommend 4 a day, so each bottle is going to be a month's supply. You don't want to mess around when you're pregnant. Okay, you want to make sure you're getting all the stuff you need. Okay, now that's as close to one-stop shopping as I can get for someone who's pregnant. Remember, the mother is literally trying to make a baby out of her body and the food she's putting in it. So there's a lot of nutritional demand. My mom didn't need enough folic acid when she was pregnant with me. I have a slight case of spina bifida at the 5th lumbar. Okay? I also believe that's why I have a poorly functioning immune system, or have struggled with that in my life. You know? And so I don't think my mom got very good nutrition when she was pregnant with me. I've determined that. I don't think she did. So she didn't know, you know, I mean, it wasn't, this stuff wasn't known very much, but especially back then. I was born in 69, so the only other, I would say, must product for a pregnancy case would be a good fish oil to go with a good whole food prenatal vitamin. And again, the garbage they would give you in the the MD is garbage. These dudes don't know anything typically about good nutrition, about what it takes to build a healthy baby, which is what you're trying to do. Okay, you need to be on a good whole food, well, not whole food, but good molecularly distilled fish oil that's been screened for, you know, like radiation and heavy metals and stuff like that. I like the tuna omega-3 from Standard Process. I do 4 a day. The reason you need that, the biggest reason, is the DHA in the omega-3, that this one has a very, very high content, of much higher than even a cod liver oil. And the DHA is essential for the baby's brain development. Essential. Just like folic acid is essential for neural core defects in a developing baby in the womb. The DHA, and these devils took DHA out of the formula in America for a long time, and they did it on purpose. And they gave you soy formula with no DHA, all done by design and then they vaccinate your child to the gills. All done by design to kill your baby, to devastate it. So it's very important. I'd say if you're going to do just 2 things, you want to do those 2 products. Okay. You actually take the trimester 3 and you in post, so you can take it afterwards, especially if you're breastfeeding, which is what you should be doing. Okay. Now, the only thing that the prenatal doesn't have, I think, enough of is a little bit more calcium, which is really important also. I believe it has enough iron. The only thing it seems to be lacking a little bit is calcium, so you might want to add in a calcium lactate, the one I use from Standard Process. It only takes 1 step in the human body to convert to usable calcium, which is calcium bicarbonate in the bloodstream. It's not milk calcium, okay? It's the calcium of lactic acid. It's the way they make it, and it only takes 1 step in the body to convert to usable calcium. So calcium lactate by Standard Process is a good one to add in if you were going to do, let's say, 3 things, okay? Add to the protocol. So that's about all I say. Okay, I'm not saying there's not other things that are needed, but that's what I typically advise women that are pregnant. The kids line I have, unfortunately, Innate discontinued their kids line. I have no clue why. I read in the riot act about it. I mean, I didn't cuss them or anything, but I was not happy. And so I went over to now Catalin does have a chewable Catalin, but it doesn't taste that great. And a lot compliance with children is everything. If you can't get the child to take it, then what good is it? So I have a gummy that we brought in. It's an organic gummy. It's called Nature's Dynamics Garden Kids Multi Gummy, assorted flavors. It tastes really good. Kids love it. Okay, and it's all organic fruits and vegetables and stuff in like a gummy with vitamin, whole food vitamin, everything. It's good. And then they've got the chewable probiotic gummy. Well, no, it's not. It's just a chewable probiotic. That's a good way to say, well, how do we give them probiotics? Well, you can open up flora capsules, or you could give them this one, which is good for their intestinal tract. And then they've also got a Nature's Dynamics Garden Kids Omega-3 gummy, which is the good fats they need for brain development and hormonal production, all the other stuff. Now, the thing about it is it smells fishy on that one. So not all kids are going to do it. Okay? Standard Process has one. It's the Tune Omega-3 that I mentioned before, but it's a chewable one. It has a flavoring in it, and it doesn't really smell fishy because it's inside the thing. So there's a couple options there. And then for the best vitamin, the whole food vitamin C for kids, the one that I really believe you'll get the highest compliance with is the Innate Response C Complete Formula. It's the powder. It tastes really good. For the adults, I like to do the C400. It's a better value, and you get, it's a tablet, so it's a little bit more convenient. So, okay. And let's go further here. I got a question from a listener, and this just came in this week. And again, I get tons and tons and tons of questions. Just every once in a while, I'll pull one out and go over it if I have time. But here, this is typical. If I tried to get to the health questions, I'm on part 7 right now. I've never done 7 parts. This is like a record for me. I should get some small medal for this. No, just kidding. Teasing. But this is a listener question. Heart arrhythmias, what to do for a heart attack or stroke, rheumatoid arthritis, and I threw in osteoarthritis help because she asked me about rheumatoid. Because I wanted to, address that as well. She says, I have a couple of questions. Actually, it was a little more, but hey, it's okay. Who's counting? I would like to know what you would do if you had these problems. What would you do if your heart got out of beat? Okay. What would you do if you had rheumatoid arthritis? What would you do if you were having a heart attack or stroke? Okay, so here, my response. Okay, if your heart's a regular heartbeat, any heart rate and rhythm problem, okay, there's a product that Standard Process makes called Vasculen, specifically for that problem, okay? It's for electrical problems of the heart. Okay, you need a specific fraction of the B complex in a whole food form. You need what they call a protomorphogen DNA template of the heart. It's like a glandular. Some other cofactors. You also need a whole food E complex to get heart rate and rhythm cases in line. You give them Vasculen. If it's really bad, give them 9 a day. These are food tablets. No, 9 a day, I'll overdose. No, they're food tablets. You need more of them at the beginning, and then you taper off as you get better. It's the exact opposite way you take a drug. A drug, you take the least amount in the beginning. As your receptors fill up, because the drug is your body's adapting to it, then you have to take more and more of the drug. It's the exact opposite with whole foods. I'm trying to get people out of the woods as quickly as possible, so that's how I approach things. You also want to do magnesium. I use magnesium 300 by innate for irregular heartbeats as well. Rate and rhythm and heart, magnesium is really good for that as well. So I do the two together, Vasculen and magnesium 300. Now, what would you do for a heart attack? Okay. Now, this is not to be confused with a Big Mac attack. So I might be dating myself, but McDonald's used to do commercials about the Big Mac attack. Are you having a Big Mac attack today? Come in and get your GMO Frankenburger. Sorry, I lost control. Here's what you do for a heart attack. A little cayenne pepper in hot water. Okay? A lot of times that'll bring somebody out of a heart attack, believe it or not. It's a commonly known thing. A lot of people carry cayenne pepper with them. Problem is if like you see somebody out on the street, it's not like, oh, I just happen to have a cup of hot water here, or warm water. Cayenne pepper is really heavy duty stuff, so compliance might be an issue. So I'm not saying that's always practical, obviously. If it was a mild heart attack, I think it was, a massive one, they're going to be like passed out or you're doing CPR on them. Okay. Also, what acts as natural nitroglycerin in the body is a product that's standard process made, which is a specific fraction of the E complex faction that is the first thing that is milled out in the milling of bread, is called the E2 component. I believe Royal Lee was the one that developed it and isolated this E2 component. It literally acts like natural nitroglycerin in the body. What does nitroglycerin do? Dilate the coronary artery, oxygenate the blood. It acts kind of like that. I'm not saying it has the same drug-like effect exactly, but you're super oxygenating the blood. If you had them chew up some E2 and little bit, not like, you know, copious amounts of cayenne pepper in some warm water, that'd be a really, really good remedy. Now, is that going to really fix the problem ultimately? No. At best, it's going to get you out of the woods for a little bit. Typically, if you're having a heart attack, it's because your arteries are clogged up. Okay? That's the thing. I mean, that's what's going on there, typically. So, what do you do about that? The only way I know of to really approach that most effectively is EDTA chelation. The best kind you can get is IV, intravenous EDTA chelation, which is a pain. Got to find somebody that can do it. MDs, not very many do it. It's frowned upon because it actually fixes the problem. So the medical society hates it with a passion. 150, 200 bucks a pop, most likely. You got to sit there with a big old catheter needle in your arm for 45 minutes. You might need, if you're really bad, 30 to 40 treatments, 50. But it will clean you out. It will. I've had people that, you know, I've seen, and they said, save my life. Now, if you can't afford that, and you feel like you have the time, you give them EDTA, the powdered form. I found this, well, I've been using this company. They make a really good food-grade hydrogen peroxide. Guardian of Eden. And I'll give you the links here below. I don't sell it. I can't touch their price, and I'm just going to refer people to them. And you can buy it from them. Big old canister. Lasts you a long time. Take a scoop, put it in the mouth. I'd hit your tongue with some peppermint oil before you do it. It doesn't taste super bad, but it's weird. Put it in the mouth, get it under the tongue, take a few drops of DMSO. You can get it at most health food stores. Few, 3, 4, 5 drops. Put that. Don't taste good, but hey, the peppermint oil's there. Get organic peppermint oil. I like the one from Now, N-O-W. Let that sit in your mouth for at least 5 minutes. You know, swallow it. You're going to get sublingual absorption of the EDTA, and the DMSO is going to drive it in even further. What I'm telling you could literally save your life. It's the reason my dad died, because he didn't do that. Now, granted, I know that had a lot to do with God bringing him to the point where I can leave him to the Lord. I get that. But I'm saying because he didn't do that was the biggest reason he had that massive heart attack and died. I found out literally the night he had the heart attack. I'm like, oh, good, I'm glad I've given you 2 sealed bottles of this, and you've never touched either. Way to go. He's dead the next day by that time. If he would have done that, I believe he would still be living. And my dad had bad plaquing all the way into his 30s. It was a wonder he lived as long as he did. He did everything else I told him to do. I think that bought him the time, but man, it wasn't enough. So Cardio Plus is if you have somebody that's a coronary type, high blood pressure, you give them Cardio Plus by standard process. But if it's because they have plaque into the arteries, you've got to give them EDTA, and really you would really want to add in nattokinase as well. I'll just go ahead and kind of get into that a little bit. Now, what I'm doing is I'm posting my whole newsletter on cardiovascular issues, heart disease, high blood pressure, arteriosclerosis, HDL, LDL, high cholesterol, triglycerides, arrhythmias, angina, rapid pulse rate, tachycardia, and obesity. All of the things that I can't get into it. I don't have enough time. This needs to be my last part. I'm running out of time on this part even. But I give you a ton of things to do, okay, that you can do. You know, you can use the Cataplex E2 for angina or chest pain. I already told you about the vasculin in the thing. For arteriosclerosis, nattokinase is a enzyme derived from soy. Now, it's not soy. It's an enzyme derived from soy. That's all it is, okay? And you take it on an empty stomach, and it will help thin the blood naturally, and it will help deplaque the arteries to a certain extent. But it is not enough to think that you could take nattokinase and have all your arteries cleaned out. I don't believe it does that because I had my dad on it, and I think it helped for a long time, and I think it kept him out of the woods, but ultimately it wasn't enough. But then again, he was going out and sneaking whole bags of candy behind my back, and come back and had all his candy stash everywhere, and was found out he was sharing it with Taylor all the time, and all kind of stuff, and he was hiding a lot of stuff behind my back. That he was doing a lot of wrong stuff. And when my dad bought candy, it would be like buy the large jumbo bag. He had these things hit all over. Did he have them hit all over the house? Yeah. So, anyway, I tell you about the chelation sessions here in this thing, in the article. I tell you about nattokinase, and I tell you about the EDTA oral chelation, how to buy it, how to take and then go back to the nattokinase, how to take it. The one I actually do carry, you just do 1 capsule twice a day on an empty stomach. The reason you do that is you want it to get undigested into the bloodstream so it can work in the bloodstream. But if you're currently taking a blood thinner, you never take nattokinase with a blood thinner. It'll thin your blood too much. Okay? If you're taking a blood thinner like Coumadin, which is literally rat poison, which is what it was developed for, okay, and I'm not lying, it really is, you would never take nattokinase with that. So I give a whole article in here on EDTA and how it cleans out the arteries. And then I tell you that how to take the EDTA, all the descriptions I just said. You don't have to email me. It's all in this newsletter. So any questions you have on cardiovascular issues, please reference this newsletter because most likely I'm going to answer your questions plus a whole lot more. I give you all kind of stuff in here to prevent heart problems, to prevent what they call disease. I don't call it a disease. It's just a natural byproduct of what you're putting in your body. It's natural things that are happening. It's not like some disease. I caught some disease. I caught heart disease. No, you created that by what you're putting in your mouth. Most people are digging their own graves with their teeth. That's what it boils down to. The best way to find out if you have arteriosclerosis, and if you have high blood pressure, it's a very good thing you have arteriosclerosis, okay? Plaque into the arteries. But the best way to find out is through vascular screening tests. For years, I've referred people to a company called Lifeline Screening. For a fair price, they perform a full I used to literally have patients come into my clinic and they would pay them. I didn't get anything from it. I just wanted to see them get the screening tests. They would set up in my clinic where I was at. They would screen my patients, and they'd get these tests. And it was really affordable. They would do a Doppler ultrasound of the carotid arteries, which is the gold standard, is the best way to find out if you have plaque in the arteries. You got come in there and you got 80% plaquing of your carotid arteries. That's not because you have a lack of medication. And even the supplement I give, Cardio Plus, isn't going to deplaque you. You have to go after the source of it. You have to deplaque your arteries. Okay, and that's done through EDTA chelation. Pomegranate is very good to deplaque the arteries as well, and nattokinase to a certain extent. I think they're all great together. Okay, and I give you all the information about that in here. Tachycardia, what you do for that, which is high pulse rate, organically bound minerals by standard process. Okay, that's what I prescribe. It feeds the parasympathetic nervous system, which is like the brakes to your car, slows the heart down naturally. Okay, it's not because you're deficient in a drug. If your blood lipids are all messed up, okay, and again, that's a whole scam with the cholesterol thing, but if they're really, really messed up, you want to be on a good fish oil, and you want to key on liver and gallbladder, because that's where the fats are processed. So that's where you start if you have aberrant HDL, LDL, or VLDL cholesterol levels. And again, you got to understand the thing about cholesterol. They keep lowering the numbers, so everybody will go on Crestor and Lipitor. Before, it was anything below 300 for total cholesterol. Now it's like some unbelievably low number like 150. So everybody, guess what? Every time they load the number, wow, we suddenly have, 5 million more clients that need this drug that they didn't need yesterday because we lowered the numbers. We're cooking the books. It's a big scam is all it is. So bear that in mind. I've done a lot of studies on that, just keying cholesterol in the keyword search box, or I have a report I can send you. And then keeping the liver and kidneys clean also will help with blood pressure as well, because they're filters, and if the filters are all gummed up, the body has to create more internal pressure in order to get the blood through the filters. Okay, so keeping them clean. Livoplex is probably the best overall one I have for the liver, and Renofood is the best overall one I have for the kidneys. Okay, so these are just all things. I even give you, like, there's a little ordering form at the thing and gives you some prices and stuff. And again, I'm not doing this to try to sell. I'm doing it because this is like super important information that a lot of people need and can literally save your life. You know, so I mean, it's just a very, 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 very important stuff to think. Because the thing about I found with cardiovascular issues, especially if plaquing is not involved, it's some of the easiest issues to help, but some of the most dire issues if you don't do anything about it, meaning you can die from this stuff, kill you, die, you know. And the plaquing is probably the most complicated scenario, and it's one of the most common scenarios, you know, for that. So let's go back to the question here. I'm just about done. Okay, then she asked for stroke. Stroke. That's a little bit more complicated. Stroke, again, probably because you're all plaqued up. But that's not going to help you if you're having a stroke. Well, you need ejaculation. If you're having a stroke, okay, I'm not going to, or a heart attack, I'm going to say, obviously, I have to, as a doctor, seek medical care. Emergency medicine is probably the best route to go to get you out of the woods. I mean, unless you can avoid it through cayenne and these types of things. But again, you haven't really done anything to fix the underlying problem. Ejaculation. But if there's damage from stroke, what you want to try to do is get yourself into a hyperbaric chamber, oxygen chamber, which can literally start repairing whatever brain damage happened, regardless of if that area has been, but you got to do it quick. You can't wait for like weeks. You got to get in there, preferably the sooner the better, if you want to really reverse the damage. Nattokinase is very, very good at helping to reverse stroke. Anything you're going to do to increase oxygen, Cataplex E2, deplaquing the arteries, really, really good for all that. But as far as a stroke goes by itself, if it's a bad stroke, I mean, you got to seek medical care. I can't tell you anything but to do that on that one. But I'm telling you some other things that can get you out of the woods afterward. Anything that's going to promote brain function. Neurotrophin by Standard Process, which is a really good one for brain. Ginkgo Synergy, which helps oxygenate the brain. These are all Standard Process products. These are the products I know, okay? You can use other derivations of them. Of course, you can't really on neurotrophin because it's a specific protomorphogen and glandular just for the brain, and they're the only ones that make it. But anyway, this is the stuff that I know of. These are like the tools of my trade. And this is like what I would do with a patient if I gave them a consult in the past, if they were my patient. So now I just give it away. Whereas before then, I charge for it. And I mean, it's how I made a living. But again, that's why I can't take patients now. Because there's no way I have the time to sit down and do consults anymore. I just don't do it. I'm too deluged. For rheumatoid arthritis, simplest protocol I can give. Rheumaplex, which is a specific product that Standard Process makes, that's like 6 different Standard Process products in one capsule. It's like one-stop shopping for rheumatoid arthritis. Rheumaplex, 6 to 9 a day. Well, why so many? Well, because it's 6 products in one capsule. You'd be better off doing 9 or 3 with meals. And the cod liver oil by Standard Process. I think that is one of the best products I have ever used in my life. I was having all kind of inflammation. I was going to the chiropractor, this local guy that I found here. And an excellent chiropractor. Really good. Okay. Adjusting me, getting everything to move. The guy was an excellent adjuster. I was still in, I know I was holding my adjustments. Had all this inflammation in my neck and my upper back. I thought, am I working out too hard? What am I doing? And I got on that cod liver oil for a day. See, you got to understand, cod liver oil has an effect on the prostaglandin cycle in the body, which is your inflammatory system. It mediates the inflammatory response. This essential fatty acid in cod liver oil mediates this prostaglandin cycle, which calms down the inflammatory process. I'm like a different person. I have like virtually no neck pain now, no upper back. My left hip was starting to hurt. I was always in pain. I was doing all kind of, going to the chiropractor, I was doing all kind of like the where you're doing trigger points with like tennis balls and pinpoint things like that. And I mean, I was really hurting. And I'm thinking, oh my word, what is going on? I got on that stuff. It wasn't like instant, but I don't think I was taking the right dosage either. You need to take enough. It lubricates the joints, helps mediate the inflammatory response. And I did it in conjunction. I went to Sports Authority and I bought one of these Homedics model PAMHTHP. It's like a kind of like a wand with a big, looks like a gray alien if you look at it. Kind of. It kind of looks like a gray alien robot head if you look at it. And you get that right on those trigger points. You turn it on high, and you get right on those trigger points. And I'm telling you, you do that in a cod liver oil, and granted, I'm leaving a couple things out because I do the JCTH by Innate, which is your good. I tell people, here's the thing, here's the key to joint protocols, okay, for joint health. Now, this is separate a little bit, a tiny bit from the rheumatoid protocol, from the osteo protocol. You have some of your joint issues, previous joint issues, my joints hurt, can't hold my adjustments, whatever. You put them on Ligaplex 2 by standard process, which is where you're going to get your manganese. It's almost like a multivitamin as well. It's so complete. If you're going to take it like a multivitamin, do like 4 or 5 a day, capsules. Then you give them JCTH by Innate Response Formulas, which is your good non-shell food derived glucosamine, which is hard to find, and with a whole bunch of other anti-inflammatory things in that product. Excellent product. But then you've got to do a good fish oil, a good molecularly distilled fish oil. The one by standard process, the one I've been doing, it's amazing. I do 3 to 4 a day. It's made a bigger impact on my joints than anything I've ever done. Now, granted, it doesn't make me hold my chiropractic adjustments. It doesn't build my joints up like the JCTH does, but it was the one thing that was missing for me. Okay, so I'm including this cod liver oil by standard process in all joint protocols now. Anytime inflammation is involved, and it pretty much is involved with any kind of joint inflammatory case, get them on a good fish oil. Okay, it's essential, and you will see. I mean, give it some time, but you should start to see amazing results. If you can't handle the fish oil because it's an oil, don't do it on an empty stomach. But if you can't handle it, even taken with meals, that means your gallbladder and liver cannot handle it. Particularly gallbladder, got to do a gallbladder liver flush. You can do the flush I've outlined in the past, or you can take a product called AF Beta Food and do a large bottle and choline with it. Defats your liver, breaks down gallstones, and cleanses the liver and the gallbladder. 6 a day of each for 4 bottles of the choline, which are 90, and 1 large bottle of AF Beta Food, which is a 360 count bottle, which would equal a 2-month cleanse. You say, well, come on, that's too... If you've never done a liver gallbladder cleanse, you owe it to yourself to finally give yourself that oil, lube, and filter your body's been wanting after that 150,000 miles that you've driven. Okay? That's all I'm saying. So understand, if you can't digest fats, you're going to be set up. You're going to have you're going to get to a point where your gallbladder is going to need to be removed. You're going to go in for surgery. You're going to take it out. They're going to tell you it's a vestigial organ. You don't need it. That's garbage. You got to have it to digest fats. You'll never digest fats right again. And your hormonal system will be more messed up than it ever was before without a functioning gallbladder. Well, what if I already got mine out? Then you take Cholacol by standard process, which is a bile salt, which you should take with every fatty meal. And you still want to do a liver gallbladder cleanse. Even though the gallbladder might not exist, you still got to cleanse the liver because the liver will get gummed up. And a lot of times people will even do gallbladder stone flushes without a gallbladder. Guess what? They still pass the stones. Where are the stones coming from? They're coming from the liver. They're called liver stones. You still get them. Gallbladder's super important. You know what's funny about God? He put all those organs in there for a reason. The appendix, the tonsils, the adenoids, the gallbladder. Well, I thought that according to Darwinian evolution, they were just vestigial organs we don't need. No, actually, Darwin lied to you. Yeah, he did. We need it all. So that's what you do, okay? That's just, I've kind of been wanting to say this for a while, especially about the cod liver oil. Man, wow. Stuff's awesome. So, for rheumatoid arthritis, bare minimum, you do Rheumaplex by standard process, which is their specific product for rheumatoid arthritis, 6 to 9 a day, preferably 9 until you get it under control. And I'm not saying it's going to make your big, gigantic knuckles that are hypertrophied from the rheumatoid just go back to normal. What we're trying to do, though, is get that inflammatory response calmed down and hopefully stop it from progressing and maybe hopefully get you out of pain. Okay? The joint cases are the hardest cases when you're dealing with rheumatoid or osteo because the damage has already been done. You got an osteo case, the joint space is gone, you got all kind of massive spurring going on, you got bone on bone. How are you going to really fix that? Barring me either, number one, having a magic wand, and I just ran out just last week, so I don't have any more magic wands, or God healing you, which he can do, but, you know, that's between you and God. So, again, rheumatoid, rheumaplex, cod liver oil. Bare minimum. Okay? You might want to add JCTH in there by innate for your joints. That would be a good one to have, too. Osteoarthritis. They have one as well for osteoarthritis called Osterplex. Okay? 6 to 9 a day, preferably 9. It's like 6 different standard process products in one capsule. So you take more of it so you don't have to take the other 6. It's all one-stop shopping for osteoarthritis. Okay? You do that with the cod liver oil, 3 to 4 per day. If you can't digest it, remember, you need a gallbladder liver flush. That by itself, you should see great results. But again, when you're dealing with osteo, you're dealing with bone. You're dealing with one of the slowest responding areas of the body. You're probably going to get quicker results from the cod liver oil because it's going to mediate the prostaglandin response, which is going to help the anti-inflammatory aspect of it, which will calm down the pain levels. Okay? But that's the thing. And again, if you want to add something else in there, it would be JCTH, the joint, because that's going to be one other level of thing you can add to help the joints in as much as the body's possible. Not only act as an anti-inflammatory, but to help to rebuild it. But again, that depends on age, activity level, how much damage has been done by these processes. Some things in the body are really quick to help. Hemorrhoids, stuff like that, usually get somebody out of the woods really quick. When you're dealing with bone, slowest responding thing, basically. Other than maybe like a spinal cord injury. Which again, if spinal cord, you want to get them in a hyperbaric chamber as quickly as possible. Okay, I think that's it. I think I've part 7, and I'm maxed out on time on this one as well. So I'll go ahead and close us out in a word of prayer. Heavenly Father, we do thank you for this day, this time you've given us. I thank you, Lord, for letting us come together to explore these issues, Lord. I pray, God, regarding all that we have talked about today, particularly the issues we were talking about near the beginning and toward the middle, and this, that you would intervene, that you would expose this wickedness, Lord God, that you would intervene for the cause of righteousness, that you would destroy the plans of the wicked, all of these nefarious evil plans that they have, Lord God, to destroy humanity in this country, that the true remnant church that you have here would rise up and would come out of their slumber and apathy, Lord God, and would rise up in mass against this in a biblical way through prayer, through fasting, whatever proactive ways that you would convict them to do, that they would help to educate others, that you would use them mightily, God, for your glory, that you would use them to lead many people to the Lord Jesus Christ. I pray you forgive us for any and all sins we have committed, as we forgive those who have sinned against us, and the words of our mouth and the meditations of our heart would be acceptable in thy sight, O Lord, our strength and our Redeemer, that you cleanse us from presumptuous sins and secret faults, that they would not have dominion over us. And we ask all these things in the name of the Lord Jesus Christ, we pray. Amen.